Yes, morning everyone. Thank you very much for inviting me to be here. I'm just going to make sure that this is working. And it is. Excellent. Good. Yes, so as Tim says, from the University of Winchester, where I run something called the Volunteering Research Hub, which is really a collaboration between a number of different universities now, Community First, Hampshire County Council, Good Neighbours Network, MHA is on there, the Integrated Care Board now come, Citizens Advice, and there are more organisations that kind of come periodically in and out as well. The main aim that we have had for this hub is to try and develop kind of a theory and an evidence base for volunteering that can feed into volunteering local priorities, strategies, interventions, kind of locally, regionally, and then increasingly nationally if we can. So the data we're going to talk about today, or the research I'm going to talk about today, was some work that we've been doing since 2018, looking at some kind of large-scale studies that we did, looking at volunteer motivations and experiences, mostly speaking to your volunteers, I have to be honest with you. So your volunteers across Hampshire and the Isle of Wight. At the moment, we've spoken to about 2,500 volunteers using various different kinds of methodologies. And if you've sent out one of our surveys, we do really thank you at this point, and I'll pick up on that at the end. So the data that we're going to talk about is that we've collected some data pre-COVID, and I'll whiz through that quickly. Some of the data that we collected during COVID, and then most recently, some of the data that we've been collecting in this kind of post-COVID period. And mostly what we've been trying to do is to really look at the shift. So what's been happening to volunteers across that time, what's been the shift in kind of motivations, but also in some of their experiences, and how some of the experiences during COVID have really kind of what those look like today. I think I'm just going to kind of whiz through this pre-COVID bit in a way because it feels slightly like old news now. But one of the things that is really clear from all of the data collection that we did pre-COVID was that kind of social and community connectedness was a really important part of getting people to start volunteering and to stay volunteering. And I'm sure that this is not news to you. And this happens in lots of different ways. So we know that people who start volunteering already have higher levels of social and community connectedness. And so this is shown by the fact that most of the people, when we ask them how they get into volunteering, they do it either because they knew somebody who volunteered or through word of mouth. But that kind of implies an existing level of social connectedness to start with. We also know that as people go through their volunteering journey, they also get more socially connected. So that social connectedness level goes up, and the more it goes up, the more likely they are to stay as a volunteer. So where people are volunteering for a kind of social or community need, unsurprisingly, if you meet that need, they tend to stay as volunteers. So there is something very important about feeling connected to and that you're personally contributing towards some kind of community, social, or other volunteer group. Peer support is something that came out across all of the work that we've done. Peer support is something that's really vital in terms of building the sense of connectedness in volunteers. And also there is something very important about the ways in which people use volunteering to manage transitions. And these are often transitions that could lead to social isolation, so retirement, new job, moving to a new area, often January, the new year, kids going to school. So there's a variety of different kinds of transitional moments that are really key places, I guess, in people's lives where they might choose to move into volunteering in order to self-manage some kind of sense of disconnect. And so there is kind of a way in which volunteering is used as a bridge to new social connectedness. Probably also unsurprisingly, because of this social connectedness, we know that volunteering is quite good for your well-being. We know that it helps people feel better about themselves, it improves their mood, and also leads to lower levels of anxiety in all of the work that we've done. We know that there is a stage at which this is the most profound, so the moment where people move from being a non-volunteer to being a volunteer, and that they actually don't have to volunteer that much in order for these benefits to accrue. So somewhere, we say 1 to 2 hours a week, but that's because that's the lowest amount that we measured. So we are going to revisit that. So we collected and finished that data somewhere around December 2019, and we were just getting ready to go out and to do loads of stuff with it, which was really exciting, developing training and all sorts of things, and then COVID happened. And that completely disrupted, I guess, the landscape of volunteering. So we saw kind of two different things that happened at the same time, one of which was the largest mass mobilization of volunteers in a generation. that there were new people who volunteered who'd never volunteered before, or who helped in a kind of broader sense, who'd never helped before. The profile of volunteers changed drastically, but at the same time, we also saw a really significant disruption to volunteer experiences. So the ways in which they were volunteering were not necessarily the same, and the rise in mutual aid group volunteering is one good example of that. So across this, we know that some things stayed the same. So people who volunteered during COVID, no matter how much they volunteered, did feel more connected to their communities than people who didn't. So that sense of community connectedness remained. However, that didn't feed through into their motivations. So the people who volunteered during COVID had very specific COVID-relevant motivations for wanting to volunteer. Lots of people said that they volunteered to do something or to fill their time. So these were people who were on furlough, for example, or people who simply wanted to get out of their houses, which was a completely understandable response at the time. Lots of people volunteered because they felt that it was some kind of duty or service as well. So there was a lot of people who told us they volunteered because they thought they should or because they could. So there was a kind of a much bigger sense, if you like, of that kind of volunteering as duty. And lots of people spoke about how their volunteering felt noticeably less voluntary. So they were volunteering because they had to, not necessarily because they wanted to. And there was a group of women in our sample of around 45 to 54 years of age who were particularly telling us that they were volunteering because they felt that they needed to do something. So there was a sense, if you like, in which volunteering at that time was less voluntary. One of the things that to then come out of that was that there were very different groups of volunteers who then had very different experiences during COVID as well. And so we have grouped these into three different groups. So we had kind of new volunteers, so people who had never volunteered before COVID and who volunteered during COVID for the first time. We had existing volunteers, so people who had volunteered before COVID and continued volunteering during COVID. And then what we had were we called the stopped volunteers, so people who volunteered before COVID and then had to stop volunteering during COVID. So there were these three very distinct groups of people. What was kind of evident in the data that we have is that new volunteers had worse well-being outcomes relevant to all other groups in our sample, and that included non-volunteers. So their well-being during that volunteering experience was in fact worse than the people who didn't volunteer at all, and that's a very unusual finding for volunteering research. Generally, there is a tracking in which volunteers always do better than non-volunteers, even if they don't always do better than other volunteer groups. The more that people volunteered, the worse that became, so particularly people who volunteered quite a lot. And we know from all the qualitative work that we did that people felt or that people didn't know about the kind of usual support that was existing. So these people who walked into volunteering for the first time didn't get the kinds of usual support, either through peer mentors, because everyone was self-isolating and they couldn't see anyone, because some support mechanisms weren't there, or because of the pace at which volunteering was happening or it was mobilized. Sometimes those support structures just didn't exist. And so we've got some quotes, which I won't read out, but you can read, but where people were feeling that, for example, this particular participant talks about how they didn't have an induction, they didn't meet anyone, they were working all of the time, and they just had to stop for their own mental health. And there were a number of responses that we got that were like that. We know for the existing volunteers did okay. They had quite good well-being compared to other groups, and they did a lot better than non-volunteers. There was something for those groups about the amount of time they spent volunteering. So people who volunteered for about the same amount did pretty well. People who increased their volunteering hours by quite a lot, less so, but still better than other groups. Lots of those people had a considerable kind of disruption to their roles. So loads of them were doing volunteering roles that they had never done before, or they were volunteering in ways that they'd never done before. And so there was a lot of talk within that group about how they wanted to get back to normal volunteering. They just wanted everything to go back to the way that it was, to get back into the volunteering roles that really mattered to them and to do the things that they really valued. I think the Stop Volunteering group I'm not going to talk about quite a lot at the moment because they're a very particular group, but just to say there was a lot of frustration for those people who were not able to volunteer at all. one of the really strong norms for volunteers is reciprocity. So I give help, and then I might receive help. That kind of norm of reciprocity is something that's kind of that mutual aid idea, I guess. It's something that's really strong in volunteer communities. And so the idea that you could accept help but not provide any, people found really difficult, especially if they'd been used to providing that help before. I think it's important to note for this group that obviously they were also, quite often they were shielding, they had other health concerns, and it was quite, this data was collected just after the first national lockdown. So there was quite a lot of unrest in this group anyway. But to say that their well-being was particularly affected by that. So if we move on then to the kind of post-COVID volunteering. So this is the kind of new data that we've been collecting now. And what we've been trying to do is to think about the ways in which these kind of volunteering experiences have then carried on in terms of how volunteers are talking about these things now. And I think that what we're seeing now in the data is that there has been a considerable challenge to normalize volunteering for those whose first volunteering experience was during COVID. They are still quite a particular group of people, and they had quite a particular experience during COVID, and that has carried on for them. We know, and this is not an academic term, but actually we know that their motivations, those motivations that I talked about at the beginning, so motivation because I want to get out of the house, because I want to do something, or because I feel like I should do something, they're not as sticky, so they don't help you keep volunteers. But people who volunteer because they want to help their community, because they want to be more connected to their community, those are much more sticky motivations. And so what we saw a lot in this group when we've spoken to them is people saying, well, once the crisis was over, then I could just stop because I wasn't needed anymore. So there was a lot of that kind of rhetoric or talk in the groups. I think that those people who didn't have a particularly good experience during COVID were also less likely to want to stay a volunteer, and most of those people didn't. So in our survey, the people who didn't remain as volunteers were also the people who didn't have a very good experience. And again, that's probably not that surprising. For the existing volunteer force, I think there's evidence of burnout. There was some considerable evidence of burnout for people who volunteered quite a lot, and lots of people decreased their volunteering time and hours in response to that as a way of kind of protecting their own mental health. And we know as well from the data that we have that remobilizing stopped volunteers didn't particularly happen, and lots of those people have remained stopped. And again, those are for some very complicated reasons. Lots of it to do with getting out of the house or not getting out of the house. There was quite a lot of fear in that group as well about catching COVID, as all the waves of COVID have kind of gone up and down in communities. And so there is an issue around how that particular group has remained stopped. And then obviously, and this was something we've now tracked in this most recent work that we'll be doing, is that time and resources become an increasing challenge, and because of the cost of living crisis, and we see this starting to kind of move through in the data. And so I think what has, I guess, been striking is that where COVID as a crisis created the kind of conditions in which volunteering could happen because of furloughs, the cost of living crisis is almost exactly the opposite of that. It's sucking the time out in terms so people can see the need, but they just don't have the time. So there is something around how those two things are interacting. I think in terms of conclusions, just to kind of wrap some of this up, I think we have seen that COVID really has fundamentally shifted volunteer motivations and experiences and what they intend to do. So I think that COVID has kind of transformed that landscape of volunteering because of the number of people who did volunteer during COVID. I think there is the possibilities around, I think there is something important around re-engaging with the possibilities of volunteering for social connectedness. We hear a lot about social connectedness at the moment. I go to lots of places and speak about social connectedness at the moment. Strategically, I think that's quite important in terms of thinking about how we can address issues of loneliness in communities, particularly for younger people and older people who we know are particularly at risk, but whom then may be quite good in terms of thinking about how volunteering can be used for those communities. I think, again, the issues around peer and other support systems and networks as being important to volunteer recruitment and retention still remains. So those were important during COVID, they were important before COVID, they remain important now. But I think there is something to think about in terms of what we're asking volunteers to do or how we're recruiting volunteers, and recognizing that actually there are different groups of volunteers. They're not all the same. They didn't all come out of COVID with the same experience. And so we may need different recruitment strategies depending on who the volunteers are. And I think this is particularly important for re-engaging those people who were new volunteers during COVID and who then have stopped since. They may need a different ask. Okay. Oh, one last thing. This is my plug. Excuse me. I'm going to just plug this, which is our Helping Community survey. So this is the survey that we've got out at the moment. I can send this through as well as a link. But if you could just get as many of your volunteers to answer this as possible, that would be great. We have sent this around lots of different kinds of networks, and we've had an incredible response rate to this already, but we're going to close it in the middle of December, and the more people and the more voices we hear from, obviously, the better the data is, and the more useful it will be for us. And just to say thank you, if you do want to get in contact with me, that's my email address. The Volunteering Research Hub also has a website and all of our reports and all of the data and everything that we've been talking about today, you'll find on there. Thank you.